I would say it's long past time for our movement to acknowledge these methods as one important option in the larger menu of contraceptive options. And, move past kind of blanket dismissal of these methods, move past blanket enthusiasm for these methods, just focus on giving people honest, balanced, evidence-based information that helps them make decisions about what will actually work in the context of their own lives. I think we all agree people deserve real choice, not an ideological agenda or a commercial agenda, disguised as empowerment.
What are fertility awareness-based methods of preventing pregnancy? Are they effective at preventing pregnancy? Why are women and people capable of pregnancy increasingly turning to them? Should we be worried about the deep-pocketed and religious forces behind them? So, to answer all these questions, we have two experts, Dr. Chelsea Polis and Dr. Rebecca Simmons, joining us today. Hello, welcome to the Famous Podcast. I'm Françoise Girard, and today we're going to talk about fertility awareness-based methods, which are methods that can be used for pregnancy prevention, but also for pregnancy creation, if you would like. Now, you might know that Famous is on TikTok. Yes, I am. And lately I've been seeing growing promotion online of what are called fertility awareness-based methods. Many of these methods are tech-based apps, for example, to track your period, your hormonal levels, and so on. And they're supposed to provide data and support to folks to either avoid pregnancy or to facilitate pregnancy. Now, the far right loves these methods, the Catholic Church too, and that has loved them for a long time. And many people who are concerned about hormonal methods of contraception and their side effects are embracing them. So I felt, it's time we talk about these methods. Now, I have to confess that I'm a bit skeptical about them myself. I've never used them. And my own mother, who was a very good Catholic, used the temperature and the calendar method when she was a young bride, and she had 4 kids in the span of 5 years before she embraced modern methods. So I'm a little biased. I have to confess my bias before I keep going. So therefore, what could be better than to bring people who are not biased, who are experts, who can give us a real sense of the evidence and a more nuanced take on all of this, the latest developments in this field. So that's what we're going to do today. And I'm delighted, therefore, to welcome 2 amazing experts to the Famous Podcast to do just that, Chelsea Polis and Rebecca Simmons. Welcome.
Thank you.
Thank you. Thanks for having us.
Let me introduce you and so that people understand your accomplishments and the level of expertise. Let's start with Chelsea. Chelsea Polis is a principal research scientist at the Guttmacher Institute, and she's held position before at the Population Council and at the sadly defunct USAID. Dr. Polis holds a PhD in reproductive health from the Johns Hopkins Bloomberg School of Public Health and a BA in medical anthropology from Brown University. Her portfolio includes work on contraception, abortion, FemTech, and other fertility awareness-based technologies, as well as infertility, sexually transmitted infections, including HIV, and other sexual and reproductive health topics. Dr. Polis has vast experience in conducting research, including randomized controlled trials. In 2023, she was awarded a John Maddox Prize by Sense About Science and Nature, an award that recognizes individuals who advance sound science in the public interest despite facing hostility or adversity. And she will tell us more during the podcast as to why she received this prize. Since 2011, Dr. Polis has held an associate appointment in the Department of Epidemiology at the Johns Hopkins School of Public Health. So welcome, Chelsea.
Thank you.
And Rebecca Simmons, PhD, is an assistant professor in the Division of Family Planning and the Department of Obstetrics and Gynecology at the University of Utah. Her research focuses on improving contraceptive access and advancing reproductive autonomy through innovative approaches to family planning care, including, of course, the fertility awareness-based methods we're going to talk about, and also health technology applications in family planning. She is particularly focused on how individuals navigate contraceptive decision-making across their lives, what are called contraceptive journeys, and she emphasizes the importance of contraceptive method neutrality, which is, I'll just paraphrase here, responding to the person's needs and values rather than pushing a single contraceptive method, irrespective of the client's wishes. And she also focuses on whole person care in contraceptive counseling. Both Dr. Polis and Dr. Simmons are widely published in leading scientific journals such as the British Medical Journal, Reproductive Health, and the American Journal of Public Health. So welcome, Rebecca.
Thank you.
So I'm very pleased to say the doctors are in. So let's talk about fertility awareness-based methods. So first of all, let's start with a definition. What are they? What are FABMs? Is that what you call them?
We usually say FABMs.
FABMs. It sounds a bit like a missile, no?
I think there's a few things wrong with that acronym that make some people uncomfortable. So yeah, we've got to work on that.
So is there a definition we could agree on? Are they the same thing as what some people call natural family planning methods?
Yeah. Well, again, thank you so much for having us on the podcast. And yeah, fertility awareness-based methods, or FABMs, as you'll generally hear us refer to them, are a group of methods that help people figure out which days during their menstrual cycle they're most likely to get pregnant from unprotected sex. And that window of time when a person is able to get pregnant from unprotected sex is usually referred to as the fertile window. And that's usually about 6 to 9 days each cycle. So the way it works is that people track different signs that their body gives them. Things like when their period starts, if there are changes in their cervical mucus, changes in their basal body temperature, or differences in their hormone levels in urine. And then once a person knows that fertile window, they can use that information in different ways. As you mentioned earlier, maybe they're trying to avoid a pregnancy, maybe they're trying to conceive, or maybe they just want to monitor different aspects of their reproductive health. And so if you're trying to avoid a pregnancy, then on those fertile days during that fertile window, you can either abstain from sex or use another method like a condom. And something else I'll mention about FABMs is they're very hands-on, most of them. For some of them, you're interpreting your own fertility signs. As you mentioned, other FABMs are kind of based in apps or devices that have algorithms that help a person predict their fertile window based on the data that they enter. And we know that only 2 apps have actually been tested and cleared by the United States Food and Drug Administration, the FDA, for contraceptive purposes. Those are Natural Cycles and Clue, although Clue isn't currently available on the US market. But there are tons and tons and tons of other cycle tracking apps and technologies and devices out there that haven't been cleared for contraceptive use, but nonetheless, many people may use them that way, which I think we'll probably get into in a little bit.
So a wide array, and some of them less natural than others. I mean, if you're using an app, I don't know how natural or, low tech that is. Not at all, in fact, right?
Yeah, I think there's a lot of interesting issues, I think, in this whole sphere around the language used, and there's a lot of confusion around the terms and what counts as natural. I think is, I've heard some people say, well, not having sex on certain days is not natural. So I think, yeah, there's a lot that could be talked about in terms of the way we talk about these methods. But I'm so glad that you asked about this term, natural family planning, because this is one of those pieces that's kind of very frequently confused and different people use it in different ways. I would say kind of in our view and the way that we think most of the folks, who work in this space view it, natural family planning does have a distinct definition from FABMs. So FABM is really more used as kind of an umbrella term for any approach that's based on tracking fertility signs. And natural family planning is more of a subset of FABMs that specifically refers to using an FABM with abstinence during the fertile window. And it's generally used in a religious context where alternative methods like using condoms or certain other sexual practices go against those religious teachings. So there are plenty of people who use FABMs in a secular, kind of non-religious way. And then the folks who are using FABMs that are really arising from a religious tradition and kind of, incorporating different sexual behaviors along those lines tend to be using what they call natural family planning. But you'll hear different people use those terms interchangeably. So it's kind of an evolution that we're trying to help people talk more easily about these methods.
Yeah. And in fact, I think some of these methods have a long history in religious practices, no? Like, certainly the Catholic Church has been promoting these methods as some of these methods, like the calendar and the thermometer and all, as the only method you could use to control fertility.
Yeah, some of that goes back to that 1968 Humanae Vitae proclamation that Pope Paul VI, I think, made.
That's right.
And basically where they were reaffirming their opposition to artificial contraception. But I think one part that was relatively underlooked in that proclamation was that the church was also asking for Catholic scientists to help them develop methods that naturally could support people's family planning desires within the Roman Catholic Church.
Yeah.
And what you had coming out of that were several Catholic scientists who dedicated significant time to kind of developing some of these fertility awareness-based methods. So from that, you have the Billings method and the Creighton fertility method, and some of these other methods that have kind of emerged as a result of people heeding that call and attempting to come up with methods that could fit this specific requirement from the Catholic Church.
Mm-hmm. And so are they effective? That is the big question. I know that the field of sexual and reproductive health and rights has had that critique of these kinds of fertility awareness methods, that they don't work. So when it comes to pregnancy prevention, what do we know, in fact, about their failure rates?
Great question. And I would start by saying, whether a given FABM is effective depends in part on the specific method and how it's used. There are dozens of fertility awareness-based methods. Most of them have, or I would say about maybe 14, 15 have been tested in clinical trials, but there are many more that haven't. So we've really tried to clarify the evidence base on this front because it has been widely misunderstood and I think, misused in many instances. So in 2018, we published a systematic review, and it's actually one that we're updating right now. So hopefully we'll have even newer evidence to share on this in the coming year or so. But for that paper in 2018, we looked at all of the available evidence on how effective different FABMs are when they were studied in a prospective or kind of longitudinal study. And what we found is that both the quality of the evidence and the effectiveness varies from FABM to FABM. So some methods like Sensiplan, which is a symptothermal type of method, or the Marquette monitor, which uses urinary hormone monitoring, had moderate quality studies. So that's better than low quality, but not quite what we would consider the highest quality. And those studies for those two methods suggested pretty high effectiveness. Their typical use pregnancy rates were between 2 and 7 pregnancies per 100 users in the first year. And that's in the same ballpark as typical use of oral contraceptive pills or patches or rings. For most other FABMs, typical use effectiveness, again, in a small number of moderate quality studies was lower. So we're talking about 10 to 34 pregnancies per 100 people per year. And that's more in line with methods like condoms, sponges, or diaphragm. So again, these are methods, they're being studied in our systematic review in prospective studies, and often the participants in those kind of studies, they're highly motivated, they have regular interactions with study staff. So we like to kind of caveat a couple things about these estimates. Those numbers probably reflect best case scenarios, real world effectiveness could potentially be lower. And since our understanding is really based at this time, given the gaps in research on these methods, which we'll talk about, since our understanding is based on a small number of moderate quality studies for each different FABM, if more and better studies come out, that could change what we know about FABM effectiveness. And then also the way that different studies go about assessing effectiveness varies a lot. So whether they're considering if people are using backup methods like condoms, if they're looking at kind of, different underlying populations that are being studied, and lots of other differences. So there's some uncertainty interpreting what the data mean, but we think there's, that the short answer is really based on the best currently available data. The short answer is yes, some FABMs seem to be quite effective for some people. They are also among the most user-dependent methods out there. So they require daily engagement to track and interpret fertility signs. They require a shared commitment between sexual partners to really follow the method's guidance. So whether that's abstaining or using a backup method during the fertile days. So, unlike something like an implant or an IUD where their user doesn't have to do much in order to have very high effectiveness, imperfect use of an FABM can mean precisely that you're having unprotected sex on, one of your most fertile times of your cycle. So these methods have evidence to suggest that they're comparable to other, widely accepted forms of contraception. But with some of the caveats I gave, for somebody who really wants to avoid pregnancies, they do require a high level of diligence and a supportive partnership. And as well, I would add tolerance for knowing that our understanding of their effectiveness might change over time if and when better data rolls in.
Right. And that study is in the British Medical Journal, right? And is that the one I'm looking at? Yeah.
That's a shorter version. So the original study was published in Obstetrics and Gynecology. And then we were asked to, by the British Medical Journal, the BMJ, to do a smaller condensed version for busy clinicians.
Right.
And in BMJ, we had an opportunity to publish this infographic that really tries to summarize what's known about effectiveness across different FABMs.
Right. So we'll post this online so people can look at this graph and also the link, because it's really interesting. You can click on, tracking your cervical mucus only, what are the different methods, the famous Billings ovulation method that we know all too well, those of us who've interacted with the far right at the UN. And then there's, other things, basal body temperature, or combination of all of those things. So all the methods are there. And what's great about this graph is when you click on it, you can get more detail and you can look at some of the sources behind it. So that's really great. I recommend that if people really want to delve into the effectiveness. Now, can you tell me a bit more about the advantages and disadvantages? Like, why, and therefore, why are people using them? What do they perceive as the advantages, and what are some of the disadvantages? One of them being, having to be very involved and also having to have a collaborative partner, which can be tricky. But tell me.
Yeah, absolutely. So like any contraceptive method, FABMs have their advantages and they have their disadvantages. I would say on the advantages side, they have no side effects. They involve no, internal device. So they really do appeal to people who prefer not to use methods that involve hormones or devices. By encouraging fertility awareness and really learning about your body and the signs of fertility that your body makes, and kind of getting in tune, with the rhythm of your menstrual cycles, these methods may promote what some people call body literacy, which people, appreciate in and of itself. Another advantage is that if your pregnancy intentions change, you can adapt the same method to try to help you conceive. You just take that knowledge about the fertile window, and that's when you start, trying to have sex in order to conceive. And then, again, while we mentioned earlier that not all FABMs are practiced within a religious context, it's important that folks, who are religious have methods that are compatible with teachings of their beliefs. So these, FABMs can be a really important option for people to whom that matters and who may have more limited choice among, some of the other methods that are out there. In terms of the disadvantages, we've already mentioned, they require either abstinence or use of a second contraceptive method during the fertile window. And depending on the FABM that you use, that fertile window can be, shorter. The shortest, I think, is probably about 9 days. The longest can be up to 18 days or more.
That's a
And
lot.
so,
Yeah.
so depending on, what your regular routine is with your partner, that may present a strain. They're also, as I mentioned earlier, they're highly user dependent and they're unforgiving of incorrect or inconsistent use. So, that can be particularly concerning for somebody who absolutely does not want to be pregnant, especially given today's patchwork of abortion bans in the US and globally.
Yeah.
For FABMs that require instruction, the quality of the instruction that you get can play a role in, how effective you can use that method. And then, of course, for some FABMs, there are certain medical or lifestyle factors that can really impact things. So irregular sleep or work or travel schedules, can complicate using certain methods.
Right.
And then, of course, they provide no protection against HIV or other STIs, but that's, similar to the majority of other methods besides condoms.
That's right.
And then finally, I would say there's a couple characteristics that it really depends on who you are in terms of whether you see it as an advantage or a disadvantage. So since partner participation is really important in using these well, some couples see that as a positive. They like talking about this. They like feeling in tune with one another. Maybe it opens up space for conversations of certain kinds. For other couples, that can be really difficult, especially, if you're in a relationship where negotiation around the timing of sex or using other protection isn't possible, then this is not going to be the right method for you to use to prevent pregnancy. And then, one other feature like that is some people really love tracking all the data and they want to see their charts and they want to wear the wearables and really get involved in all of that. Some, I'm a data nerd. I get it. Sometimes you just really like doing all that stuff. Some other people might not. And so, other people may find that it's too much to ask. Now that, again, varies on the type of method and whether you're the one doing the interpretation or you're outsourcing that interpretation to the algorithm of some device. But these are a couple of things that I think it depends on who you are, whether it's an advantage or disadvantage.
Do you see a connection between these methods as a group and the MAHA movement, making America healthy again, which is all about natural this and that and questioning established science in some cases?
I really think that there's some crossover both in kind of the values and the way that particularly FemTech is answering some of these values-based changes within the MAHA movement. For example, I think that one of the values of the MAHA movement appears to be kind of a distrust of larger regulatory bodies and traditional healthcare providers. And FABMs and FABMs through FemTech, they exist largely outside of the healthcare system. So you don't need a provider to start them. You don't need a provider to stop them. You kind of can do it on your own, which I think is kind of a kit within
self-care. Yeah.
I think a big part of the MAHA movement is this backlash against this perceived environmental toxicity. I think there's been a lot of conversation around the perceived environmental toxicity of hormonal contraception. So the fact that these don't have any sort of hormones that are being introduced into either the body or the environment as they're excreted, I think is kind of in line with this MAHA movement. And also, I think that there's kind of this idea of the individual taking primary responsibility for their health decision making. And I think these types of methods are really easy for somebody to do that. So you can pick up a technology, you can get the information on your own, and you can utilize that to make the decisions on your own. So I think there's a lot of compatibility between these current movements. And I think that's why you're seeing a lot of it being pushed to the forefront as well.
Right. And just to be clear with the listeners, we don't have evidence that hormonal contraception is harmful, do we? It might have side effects that people don't like, but that it's...
Yeah, and I think that's an important distinction. I think there's a lot of backlash right now in general against hormonal contraception for a variety of reasons. And one of the biggest is because of the side effects that people have experienced and this concern about what side effects mean for people who are experiencing them. Does that mean that you're susceptible to longer term health problems or increased risk for certain things? And I think that the big thing with these methods is because they don't have any of that, they're seen as outside of that spectrum. But as we just talked about, everything has a downside, and all of these methods have their own drawbacks that while they might not be side effects, may have other challenges that require, somebody that might be unacceptable to certain people. So it's really, with contraception and avoiding pregnancy, you're essentially always making a trade-off. So it's really making the decision that's right for the person and in that moment with what they want to do.
Yeah. Now let's continue talking a bit about the politics of these methods. On the one hand, we have the traditional family planning field, contraception, sexual and reproductive health, which has not been welcoming of fertility awareness-based methods, to say the least. On the other hand, we have the religious far-right interest, as you mentioned, in promoting these methods. And frankly, I'd argue that the reason for that is that I think a lot of these actors have a very clear, and definite view about the natural role of women in the family and in society, which is as wives and mothers before all else. So giving women greater control over their fertility and over motherhood has never been in the cards for these actors. And that's why they fought abortion and modern contraception for decades. So that's, let me put that out there. So let me know what you think about this. Let's start with the field of sexual and reproductive health. Did we make a mistake in being so dismissive of fertility awareness-based methods?
Yes. I think the short answer is a resounding yes. It sounds like Rebecca agrees as well.
More.
I think that, as you say, the field of sexual and reproductive health has been dismissive of fans, and I think we're seeing the consequences of that now. So here's kind of how I see what happened. For decades, many in the reproductive health and family planning communities have kind of ignored or sidelined or even ridiculed these methods. We know providers often lack training in these methods. Many may underestimate their effectiveness or kind of assume that they're not appropriate for the clients that they see. Researchers have historically deprioritized studying them and other things. So we wind up with a more limited evidence base on FABMs compared to other methods. And we also wind up that when patients are concerned about side effects or health concerns related to, hormonal contraception or other options, or are just otherwise interested in FABMs because they're interested in the qualities that those methods offer, they're often encountering dismissal from providers. So where do they turn when they encounter that in the healthcare system? They turn to social media often. And on social media, we have a lot of fear-based messaging about hormonal contraception. We know misinformation spreads easily, and FABMs, by some people, are often promoted with pretty cherry-picked evidence that kind of distorts, whether these methods are actually going to meet somebody's needs. We see people often, who are strong advocates of FABMs, not all of them, but some of them, waving around the best, the highest effectiveness studies that are out there without always looking at the quality of those studies or what it applies to.
Right.
And then some influencers even promote, very extreme and inaccurate claims like the pill is addictive or all kinds of other things. So I think because science, as we were saying before about effectiveness, it doesn't exist in a black and white space. It doesn't offer simple answers all the time. Sometimes our knowledge changes over time as more studies come in. But that uncertainty, coupled with that unwillingness to talk about these methods respectfully, creates this space for louder and certain sounding and sometimes profit-driven or ideologically driven voices to fill the gap with what sounds like certainty, even if what they're saying isn't accurate or helpful for the person. So, I think that our dismissal in our fields created this vacuum. And you have conservative influencers, policymakers seizing on FABMs to advance a broader agenda. And as Rebecca just said, we're really seeing this play out with the MAHA movement, where they're promoting FABMs while simultaneously working to restrict access to other forms of contraception, abortion, fertility care, slashing funding for programs like Medicaid and SNAP that help people raise their children. So, there's nothing inherently political about somebody choosing the method that feels right for them, just as Rebecca just said. I think what becomes political is how FABMs are being kind of framed and weaponized. And when we see them promoted by politicians actively working to restrict access to other aspects of sexual and reproductive health care and undermine bodily autonomy, it's clear that their interest isn't about supporting choice or health or empowerment. It's really about control. So, we would argue that it's many things need to happen, but I would say it's long past time for our movement to acknowledge these methods as one important option in the larger menu of contraceptive options. And move past kind of blanket dismissal of these methods, move past blanket enthusiasm for these methods, and just focus on giving people honest, balanced, evidence-based information that helps them make decisions about what will actually work in the context of their own lives. I think we all agree people deserve real choice, not an ideological agenda or a commercial agenda, disguised as empowerment.
Right. And of course, that would mean the traditional field of family planning would also have to walk away from some of the, population control remnants that are still very much in our field, even today, of, long-acting methods being the holy grail, because this way they can be sure to count people as definitely on contraception and, couple years protection, all these different indicators in the field of family planning that really reinforce the need for methods that, women don't control, or persons capable of pregnancy don't control, so they can't remove them and stop using them. So this is exactly, that discussion about self-care and control.
Absolutely. And go ahead.
I would say that I think some of this is getting better. I am a person who not only studies these methods, has used these methods. And I remember in 2015 going to my healthcare provider and being asked about what contraceptive method I was on and saying, oh, I'm using the symptothermal method, and my provider wrote me a prescription for pills, and she said, when you're ready, you can have here's a prescription for when you change your mind about these methods, which was very dismissive at the time.
Yeah.
But what I see now, is with the provider training that we do, is healthcare providers are really aware that people want more information, and they want to be able to provide that to the people who are coming to them. So there is a lot more curiosity and hunger for this information than I've ever seen before. And that feels very positive, but how can we harness it in a global way, in a public health way, in a way that really matters to the field and reaches some of the people that are distanced, ideologically distanced from us, to make sure that they also have that level of empowerment and support that they might need.
Right. And then, and then on the other side, there's the religious elements really focused on pushing these methods as the methods that should be used to, and excluding, hormonal and other methods like the IUD, and at the same time fighting access to abortion, which seems to me an obvious need when you're using methods that have varying failure rates. So how do we, how do we reconcile all of that and engage with these actors on that in good faith when they're, I don't think, acting in good faith?
Yeah, I think this is a tricky thing. And one of the pieces that I think both Chelsea and I can agree on with this is that working in FABMs kind of makes you a target on all the sides, right? So there's doubt on the side of our own field about this work that we do, and there's doubt on the side of, this religious right, because we support method choice and access to all methods and access to abortion. And so it's a tricky field to work in. But I think the important thing to recognize is that fundamentally, everybody wants information that is accurate and gives them the empowered decision making that they need. These are not going to be right for everybody. So what can we do to give somebody the information that they need to make that decision now and again later in the future? So what I always tell people when they're talking about these methods is like, yeah, maybe you want to try this out right now, or maybe you want to try it out in 5 years. Where can you go to get the good information that you know is factually accurate?
Right.
And that's kind of what's missing on our side, is making sure that the information that we're putting out is factually accurate, gives people a place to go to get the education that they need when they decide that they want to try this, and then how can we support them in wherever they are with what they want to do.
Now, speaking of attacks, Chelsea, you faced a frivolous and I'd say even malicious lawsuit for raising valid regulatory and scientific concerns about a fertility tracking device called Daisy, DAYSY. Unfortunately, the company lost, but that must have been incredibly frightening and stressful. I can't even imagine getting sued by a major corporation. Can you tell us what happened in a nutshell? And what does this say about the powerful, deep-pocketed forces in our field?
Yeah, it was wild. I was frivolously sued for $1 million in federal court for standing up for science. So yeah, in a nutshell, this company, Valley Electronics, that manufactures a fertility tracking thermometer called Daisy, I saw that they were making misleading claims that their product was over 99% effective at preventing pregnancy. And that is a claim saying that the thermometer is comparable to an IUD. And when I first became concerned about how it was being marketed, I reached out privately and directly, to the company and raised my concerns. And unfortunately, it led to a pretty condescending response and no meaningful change. So I went ahead and published a peer-reviewed critique of their flawed study that they were using to market the device in ways that I found to be misleading. Published that commentary. The journal agreed with my scientific concerns, and they retracted the company's flawed paper. I also reported the company to the U.S. Food and Drug Administration, and they did an investigation and ultimately required the company to change the kind of marketing language that they were using because it was not in line with regulatory requirements. So those were kind of two clear wins for public health, like removing misleading claims from the scientific literature and removing, those kind of claims from their public-facing marketing. But getting a paper retracted is difficult, and journalists got interested. And when I spoke publicly about the situation, including calling the company's retracted paper junk science, which I would argue are pretty
Tell it like it is.
Right? The company claimed that statements like those were defamatory and filed $1 million defamation lawsuit. And, yes, it was horrific to go through. What I see it as was a clear attempt to intimidate me for raising valid scientific and regulatory concerns. And these kinds of lawsuits, they're often called SLAPP, SLAPP, SLAPP suits. That stands for Strategic Litigation Against Public Participation. And what I learned about these is they're not really filed with an intention necessarily of winning. They're really a way of weaponizing the legal system to kind of scare people into silence. So it took 2 long years. I had the most incredible team of lawyers at Arnold and Porter, led by an amazing woman named Dory Hansworth, and they took my case pro bono. And the lawsuit, was after 2 years, it was dismissed, but it was awful. It opened my eyes quite a bit to how the legal system can really be weaponized. And yes, to your question, like this is absolutely happening to other scientists. I've connected with a lot of folks to whom something like this has happened, and it's really moved me to become an advocate for state and federal anti-SLAPP legislation. So if any of your listeners, are interested, I would really encourage them to kind of learn more about anti-SLAPP legislation and find ways to support legislators or organizations doing this kind of work, or contributing to legal defense funds. There's many examples I could share, but Climate Science Legal Defense Fund is one that does really spectacular work to help scientists who are facing, not just climate scientists, they focus on climate science, but they support folks beyond that field. And they do really amazing work to try to help protect scientific voices from speaking out when there's kind of the deep-pocketed situation that you mentioned.
Wow. Yeah, this is unbelievable. And, brava to you for being courageous and willing to stand up for this, and also for showing that there are ways to deal with this on a sort of systemic level, with legislation, and there should be action, because science is already under a lot of attack, and to have, in addition to that, individual people and corporations weaponizing the legal system to silence scientists is really shocking. Now, I was intrigued by an article you two shared with me that showed that in the US, there's been growing use of digital FABMs after the Dobbs decision that rescinded the constitutional right to abortion in the US in 2022. I thought that was surprising, given that some of us have been very concerned about the whole question of privacy of abortion and surveillance of abortion. And pregnancy we're not facing in the US. So what do you think is happening? People are turning their data over more to these big companies that end up suing you. I mean, are we naive? What's going on?
I think the proliferation of fem technology and the integration of menstrual cycle tracking into some of the big trackers probably contributes to some of this willingness to turn over that information. So back in the day, you had specific apps and specific technologies that were really meant for menstrual cycle tracking, and that still exists.
Like Clue.
But right now, you can also have all of that information integrated into your Apple Watch or into your Garmin device or into your Oura Ring or all of these other things. And that is kind of where the directionality of where things are going. People want an integrated information center where they can get information about their health and wellness. And I think that that's kind of leading to that. I don't think most people are considering the Dobbs decision in this decision making. I think they're thinking, man, my Apple Watch always tracks everything else. I'm putting my nutrition information, I'm getting my sleep there, I'm getting my steps. Might as well put my menstrual cycle information in there as well. And that makes sense from an integrated standpoint. But we also know that that these FemTech companies have been some of the worst offenders of data privacy.
That's right.
And that does raise real concerns. We've also seen certain instances in the United States of states trying to utilize people's menstrual cycle tracker information in cases of abortion. So even though people are doing this and it makes sense as to why they're doing this, we would advocate sincere caution with the types of information that you're inputting, and ask that people basically expect that they don't have any sort of privacy with the information that they're inputting into these devices, because they truly don't.
Yeah.
So that's an assumption that you should just make when you are utilizing these devices. Just assume that information is being taken and sold and utilized, and you have no idea.
And it could be shared with governments, state government or...
State governments, local governments, it's likely that that's a possibility. So being careful. I always advocate that if you're putting information in, utilizing things that are only identifiable for you, creating your own data signifiers, not, indicating things that could be used against you. We have several instances. I believe Flow, one of the menstrual cycle apps that's out there, just lost a lawsuit earlier this year because they were violating California privacy laws by providing data around people's sexual activity and their menstrual cycles to Meta and some of these other companies without users being aware that those connections were being made. So your sexual health, your sexual information is out to people that you don't even necessarily know, to Google, to Meta. Yeah. And those are real concern.
I don't want Mark Zuckerberg to know these things.
Me neither.
So in concluding, what would you wish we did with, FABMs? Like bring them into the field of sexual and reproductive health, as you suggested, conduct more studies. I mean, what is the thing that's most pressing in your view?
Follow the data.
Yeah, follow the data.
Follow the data. And Rebecca, I don't. You jump in and I'll
provide more funding. I mean, these studies have almost never been funded by traditional funding sources, and thus the only people who have really funded them are religious entities and venture capital funding. We need real traditional NIH-funded approaches to getting better information about these methods, put them on a scientific path akin to these other methods. That would go a long way in helping to both give us the information that we need to give to clients, as well as legitimizing them for the larger family planning field.
Right. Yeah, when religion and tech are the only actors, you got to wonder. Yeah, go ahead, Chelsea.
Along those same lines, I think just really, I think our field has, as Rebecca was saying earlier, our field, I think, has come a long way in evolving our views, and you were mentioning this as well, Francoise, around a more person-centered approach that's not based on population targets or kind of public health goals, but really grounding ourselves and walking the walk, and as well as the talk about a person-centered approach to these methods, and that must rest on a bedrock of respect, and not having that kind of dismissive attitude towards these methods. I think is another piece that would, I hope, reestablish some trust that I think has been lost in our field as a result of how we've handled some of these conversations.
Well, thank you both for this incredible conversation. You've given me a lot of food for thought. I still remain, of course, very worried about restrictions on abortion and reproductive health more generally across our field, and about the role that these FABMs are playing, politically in this time, in this space. But I'm with you. Like people are using them. People want to know more about them, and we need to respond to that and not be dismissive of it, but actually have real, honest conversations, evidence-based conversations. And so some funding would be great, right? Even in this difficult time when defunding seems to be the rule. So thank you for your time. I hope you enjoyed this too.
Yeah,
absolutely.
Thank you so much.
And the fight continues. A luta continua. Take care.
Take care. Thank you.
Bye-bye.
Thank you very much. Bye.
Expiro.